All right, I think we can go ahead and get started just in the interest of time. Thank you everybody so much for coming here tonight. We really appreciate your participation. And thank you very much to our speakers as well. I am going to introduce our introducer for this evening. So introducing our speakers and moderating our Q&A will be Dr. Carl Cooley. He is the chair of New Hampshire Healthcare Workers for Climate Action's Children's Health Working Group, as well as a member of our board of directors. Carl, I'll hand it over to you.
Thanks a lot, Emily, and welcome to tonight's webinar entitled Restoring Ecosystems, Restoring Ourselves. And it's a part of the New Hampshire Healthcare Workers for Climate Action's ongoing webinar series on the interfaces between climate and health, and is co-sponsored tonight by the New Hampshire Public Health Association and the New Hampshire chapter of the American Academy of Pediatrics. The presentations will last about 35 minutes, followed by questions and discussion. Please mute yourselves when you're not speaking. Please make ample use of the chat during and following the presentations. You can ask questions or put resources up or whatever. But we find that actual voices liven the discussion. So I'll invite those with chat questions to unmute and ask them directly. But feel free also to raise your hand during the discussion period as well. When we consider the impacts of climate change on health, one might assume we are speaking about human health. However, it's important to recognize a planetary health perspective because human health is intrinsically a part of the planetary ecosystem. And this will be the focus of our presentations this evening. We are fortunate to have two coast-to-coast pediatricians, one from Seattle and one from Portland, Maine. And I have heard them present at another meeting months ago and just so appreciated what they had to say that I was hoping they would join us one evening this spring. First is Dr. Ali Perkins, who's a resident physician at Seattle Children's Hospital. She is the founder of Pediatricians for Climate Action, a coalition of Washington State pediatricians working on climate change mitigation through legislative advocacy, medical education and research, and ecosystem restoration. Dr. Perkins is also an AAP, American Academy of Pediatrics, climate advocate representing Washington State, a leader on the trainee committee for the AAP's Council on Environmental Health and Climate Change. And I'm interested in hearing more about this at some point, but a forest steward for the city of Seattle. She completed medical school and an MPH in environmental health at the University of Washington. Dr. Abby Fleisch is a pediatric endocrinologist at Maine Medical Center, an environmental health researcher at the Maine Medical Center Research Institute, and an associate professor of pediatrics at Tufts University School of Medicine. Dr. Fleisch received her undergraduate and medical degrees from Northwestern University, as did my father and grandfather, by the way. She completed residency in pediatrics at Boston Children's Hospital, Boston Medical Center, and a fellowship in endocrinology at Boston Children's. She participated in the Harvard-wide Pediatric Health Services Research Fellowship and received a master's in public health from Harvard's T.H. Chan School of Public Health. After serving on the faculty at Children's Hospital for 3 years, she joined Maine Medical Center in October 2016. Her research is focused on the role of early life environmental exposures such as air pollution and consumer product chemicals on the cardiometabolic health in childhood. Dr. Fleisch holds several grants awarded by the National Institute of Environmental Health Sciences. So with that, I'll let the presentations begin. I think Ali is up first.
All right, I'm going to share my screen and people let me know if you can't see it. Let's see. Oh dear. Give me one moment. Okay, maybe Emily, can you pull my slides up?
I can, yes. Can you see that?
Yep.
Great.
All right. So I'll just let you know, Emily, when we can just go to the next slide.
Sounds good.
So thanks everyone for joining. It's great to see so many faces and some familiar faces. My name is Allie Perkins, as was mentioned, and I am a second-year resident at Seattle Children's Hospital and joined today by my colleague, Abby Fleisch. Next slide. So before I really get started, I want to give a big shout out to the inspiration behind all of this work. And that is Dr. Doug Ptolemy, who is an ecologist at the University of Delaware. He wrote a book called Nature's Best Hope, which really inspired me in pretty much all of this ecosystem restoration work. And many of the slides in this presentation are actually taken from some of his presentations that I've watched over time. And he did give me the green light to do so. So next slide. So I'm going to start by talking about my own home, the Pacific Northwest, and a very brief natural history of this area. So the first European explorer who came to the Pacific Northwest was a man named George Vancouver. And when he arrived in the late 1700s, he encountered a scene that looked something like this. And he wrote at the time, "The country before us exhibited everything that bounteous nature could be expected to draw into one point of view. Between us and this snowy range of mountains, the land rose from the sea in low perpendicular cliffs or beaches of sand and stone, and was covered with stately forest trees." Next slide. So humans have actually been in this area for about 13,000 years. The Vashon ice sheet covered the Seattle area 13,000 years ago and then receded as the climate warmed, and people have been there since about that time. Next slide. So when white settlers started arriving in the Seattle area in the mid-1800s, the people who were living here at the time made up the Duwamish tribe. And then the man in the middle of this slide is Chief Seattle, the man after whom Seattle was actually named. Next slide. And this is kind of what the area probably looked like. So you can see a whole host of native plants in this slide. You'll see some sword fern, some western red cedar, some vanilla leaf, and Douglas fir. Next slide. But unfortunately, we didn't keep the land that way. So today, only about 5% of the lower 48 remains in its original ecologic state. Next slide. Cities were carved out of the hills. In this picture, you can see an early picture of Seattle as the hillsides were demolished in order to fill in the port. Next slide. And we've tilled the land. You can see a before and after shot of a place in Bolivia. We've logged extensively, we've polluted, and we've paved. Next slide. And we've also introduced thousands of invasive plant species that are outcompeting native ecosystems. So in this slide, you can see some of the major culprits in the Pacific Northwest. We have Himalayan blackberry, we have English ivy crawling up the trees and pulling the branches down. And then we have some bindweed there on the bottom. Next slide. And we've done all of this because we have operated under the assumption that nature is limitless, and so we've exploited it. Next slide. And of course, now we're facing the consequences. And those consequences are massive ecosystem destruction, which has led to widespread extinction of plants, of animals, and of insects. Next slide. And this is all very important for human health, actually, because we very much depend on the ecosystem services that all of these plants, animals, and insects provide. So at an extremely basic level, We need healthy ecosystems because ecosystems produce oxygen, they clean water, they capture carbon and store it in the ground, they hold the topsoil in place, they prevent floods and protect against severe weather. They convert sunlight into food, and they pollinate and disperse seeds. Next slide. So I'm going to shift a little bit now and talk more about children and what's going on with children today. Unfortunately, what we're seeing is that there is a national emergency in pediatric mental health. And we have seen huge rises in the numbers of children reporting major depressive episodes and committing suicide. So we've seen a 60% increase in depressive episodes over the last 10 years, and we've seen suicide rates rise by over 50%. And these numbers are pre-pandemic numbers. So I can almost guarantee you that things have gotten a lot worse as a result of the pandemic. Next slide. We also have seen a dramatic decline over the last several decades, but certainly the last one, as technology has gotten more pervasive, of children playing outside. So I found a statistic which said that the average American child is said to spend 4 to 7 minutes a day in unstructured play outdoors today, in present day, but over 7 hours a day in front of a television screen or any kind of iPhone screen. Next slide. We also know that children are increasingly reporting that the future is looking pretty frightening. There was a study that was done in 10 countries that looked at over 10,000 young people and reported that 75% of them reported being frightened of the future as a result of climate change. And this, of course, is due to the fact that many of these children will be experiencing the impacts of climate change in their lifetimes, unlike many of us. Next slide. So that's enough of gloom and doom. And now I will shift to some other good things that we know. The first good thing that we know is that spending time outside is very good for our health. So adults, nature contact has many health benefits, from reduction in stress, anxiety, and depression, to improve sleep, greater happiness, increased physical activity, less diabetes, less obesity, improved birth outcomes, improved blood pressure, better pain control, and increased longevity. Next slide. And we know that many of these health benefits are true for children as well. So in a recent study that was done in Pediatrics in 2021, it found that spending time outdoors is associated again with increased physical activity, decreased BMI and obesity in children, and myriad mental health benefits, including the sense of calm and restoration, reductions in stress, anxiety, and depression, and enhanced resilience and the ability to cope with adversity. Next slide. And here comes the idea of ecosystem restoration. I read a book recently called Braiding Sweetgrass, which was written by a woman named Robin Kimmerer. And in that book, she writes that action on behalf of life transforms. Because the relationship between self and the world is reciprocal, it is not a question of first getting enlightened or saved and then acting. As we work to heal the earth heals us. Next slide. The UN defines ecosystem restoration as the process of halting and reversing degradation, resulting in improved ecosystem services and recovered biodiversity. And the UN has declared that this decade, 2021 to 2030, is the decade of ecosystem restoration. The UN has called for countries to restore a land area around the size of China by 2030, and this is globally. Next slide. This will have many, many benefits on a global scale. So restoring ecosystems at that scale will potentially contribute 1/3 of the climate change mitigation needed by 2030. And it will do so by helping to remove greenhouse gases from the atmosphere globally. Also, healthy ecosystems help trap pollution, clean and cool the air. They prevent erosion, again, protecting against severe weather, preventing against food insecurity, and rebuilding our health through restoring our relationships with the natural world. Next slide. In the American West, we face unprecedented droughts and wildfires. You can see here in the lower right-hand picture, the level of the ground in California after many, many years of groundwater drainage for massive agricultural activity. We know that if we strip an area of its plant life, the soil loses its water. But if we cover it up with native plants, ideally, then we reduce the need for water and we reduce the risk of drought. Next slide. This is an image I took from the Green Seattle Partnership website. So you can see on the top panel, a forest without restoration. And in this picture on the top, you'll see a forest in present day with trees covered in invasive species. I'm just going to say ivy because that's what is in Seattle. And slowly over the course of 100 years, the ivy pulls the branches off the trees, and by the end of 100 years, there's nothing left of the forest. On the bottom panel, by contrast, you'll see that if you strip the invasive species out of the picture, then by 100 years later, you'll get a forest that has regenerated itself. Next slide. So these are the big concepts. The next question is, what does this all have to do with individuals? Well, actually a lot, because we know that 72% of the land in the United States is currently privately owned. So if we do not start restoring ecosystems on private land, we are left with areas that are too small and isolated from each other to support viable ecosystems. In effect, national parks are great, but they're too far apart from each other and they're too small to really support the ecosystem services that we need. So now I invite you to think about what spaces you see in your life. What do the roadsides look like? Are there open spaces under power lines? What about the airports? What about the golf courses? What about hospital campuses? Next slide. And what does your yard look like? Do you have a lawn? We know that lawns occupy 40 million acres in the United States, but they really sequester a very small percentage of carbon dioxide as compared to a native plant ecosystem. And they really don't provide much shelter for birds and bees, nor do they provide very much food for those important ecosystem contributors. Next slide. So what's the answer? Plant native plants. A lot of the reasons that native plants are good for ecosystems is because they're adapted to local climates. They support local food webs. They tend to not require fertilizer, and they require much fewer pesticides. They require less water than lawns. They help prevent erosion. They help reduce air pollution. They remove carbon from the air. And in effect, they promote biodiversity and the stewardship of our natural heritage. Next slide. By contrast, ornamental and invasive plants usually don't provide the food energy that is needed for birds and bees to flourish. So if you have plants that aren't really adapted to the local ecosystems, then they don't tend to really provide the services that are needed to uphold those local ecosystems. And if you, and 79% of what is planted in our suburban areas is not native. Next slide. Doug Ptolemy has proposed the idea of a homegrown national park. And what Homegrown National Park really stands for is a grassroots movement to start restoring ecosystems on private property, just, at the grassroots level. And so if you want to start a site, you can really just take any small piece of land. It can be as small as 70 square feet or even smaller. And the only requirement is that greater than 70% of the plants in that area are native. There's no requirement that you have to register your name or your address. You just put in your zip code and you put in the number of square feet that your site makes up. And that's really all there is to it. Next slide. This is a picture of the High Line in Manhattan in New York City. And in his book, Dr. Ptolemy writes that he saw multiple species of native butterfly here on the High Line simply because they had planted native plants. And this, this, just to remind you, is in the middle of Manhattan in New York City. So next slide. So if you are inspired to start an ecosystem project, the first thing to do is to identify a site where you can start working. The second thing is to start removing invasive plants. When I started, I didn't really know very many invasive plants, so I just started with the ones that I did know. And then as I kept on working, I started to identify more and more, which was a fun process. Once those invasive plants are removed, you can focus on selecting native trees, native shrubs, native ground covers, and planting those. And then phase 3 is long-term native plant establishment. So sites are weeded, they're mulched, and they're watered as needed. Next slide. Here are some keystone species. So these are the fundamental species upon which ecosystems are built. And of course, it will be specific to whatever area that you are in. So these species are specific to the Pacific Northwest. However, if you're in New England or wherever you are, you can go to the National Wildlife Federation website and look at the native plant finder, and that will help you figure out which plants are good to start working with in your area. Next slide. So now I'm going to turn it over to my colleague, Dr. Abby Fleisch, and she's going to talk about her project, which is taking place on the Maine Medical Center campus.
Hi, everyone. Nice to meet you all. That was great, Allie. And I just wanted to say also by way of introduction that I met Allie as an AAP Climate Advocate. So we're both our state's pediatric climate advocates. And I also read Doug Tallamy's book. I'm super excited about this initiative, and was talking to Allie, who said, that she's thinking about and working on getting these projects set up in healthcare settings. Like what a great place, so much lawn at a hospital to think about converting to native plants. And so we at Maine Medical Center are so psyched to be thinking about this as one of the first hospitals in the country to be leading the initiative of working towards creating some native plant centers on the lawn of our hospital. So I thought I'd just take you through how I, as a pediatric endocrinologist researcher, started to thanks, Samra. started to think about this and where we are in the process. So I'm most of my time is spent at the Research Institute, 80% of my time. So within the Institute, I was able to identify a volunteer project manager who also had this shared interest, a plot of land, and approval from our VP of Research to convert that land, which is currently lawn and invasive species, into a native plant site. We also have a wellness committee at our Research Institute, so we were able to create a climate advocacy special interest group within the wellness committee. This all started about a year ago, maybe between 6 months and a year ago. We obtained a small budget from the wellness committee to purchase native plants. And then we've identified a volunteer team who will work to eradicate the lawn and then plant and sustain the native plants. So this is all just on a very small, again, plot of land on our Research Institute lawn. So after kind of thinking through that, we were able to make connections with the VP of Patient Care at Maine Medical Center, who's on the call, so may be able to chime in at the Q&A. That's Odette Harrell, and also the Sustainability Manager at Maine Health. And so with them, we've been working over the past several months to start to think about how this could become a vision for to be implemented more broadly on the hospital campus. And our vision at the moment is really twofold. It's first to think about landscaping preferentially using native plants at Maine Medical Center. And number two, to build not just one at the Research Institute, but 4 native plant community education sites. And so our vision for this would be plots of land where there can be signage and people from the medical center or the community can go to kind of become educated about this concept of converting like less productive lawn into a more productive natural ecosystem. And you know, the vision is as broad as ultimately perhaps at the site on the hospital campus, working with hospital residents and even perhaps pediatric patients to make this happen. So we're very excited about this. We've connected with the U.S. Department of Agriculture and Natural Resources Conservation Service, and the USDA has this great service where they can provide technical support free of charge to institutions or individuals who are implementing one of these rewilding projects. And so if you could go to the next slide. We have a site visit scheduled with the USDA in June. And they're going to come look at our 4 sites that we're proposing for our community education centers. And they'll provide a landscape plan and a technical report that will include information on how we can support and maintain the sites and what types of plantings would be best for those sites and exactly where might be the best sites to do this. I also have a summer MPH student who's going to be working with me in the months of June and July. And with her, hope to create a first draft of a toolkit that could be used both at our institution and then at other healthcare institutions who are aiming to implement this sort of project. And later this summer, we'll be continuing, I think, throughout later this summer and throughout the next year to present this plan more broadly at our institution to garner support. Thanks.
All right, great. So circling back to the kids, what about the kids? I read a report from Eco America lately that said that engaging children in even the smallest actions can help them feel like they are part of the solution. So what's going on in terms of getting children involved in this work? Next slide. Sorry about the formatting there. I think it got messed up when I downloaded it from Google Slides. But this program called Youth Ecology Education Through Restoration was started actually by a friend of mine who used to be a middle school teacher. And she has written a curriculum, 5-week curriculum, which takes students through the whole cycle of learning about ecosystem restoration, why it's important, designing an ecosystem restoration project, and then actually doing the work themselves. And she has rolled this out to 6 sites, I believe, across Washington State. You can see them there. They're really all over Washington State. And I think this is a very novel approach because it really allows children to understand the importance of what work they're doing and really do it themselves, thus giving them a sense of ownership over solutions and making them feel empowered in a very, very confusing time in history. Next slide. And I think that's the main question that I really want to look into going forward is what are the benefits of this work? Is there a benefit not just from spending time outside, but really working to recreate and restore an ecosystem to bring the world back to health? And can that help people when they deal with really stressful situations like the situations that we're facing as a society? And I know on a personal level, it really has helped me. So by my hypothesis is that it would also help a lot of other people. Next slide. So that sums up our talk. I think the important thing is to think about next steps. So if you have not read the book, Nature's Best Hope by Doug Ptolemy, I think that would be a good place to start. It goes over a lot of these concepts at a more global level. And then once you've done that, I think looking into local resources is very important. I'm very lucky in that I'm in Seattle. And so there are many, many, many organizations locally doing this work. But I have looked throughout the United States, and I think in almost every single state there is a native plant society. So I know that there are many, many, many resources out there for people to access who are interested. And then the third step would be to think about the places in your life over which you have influence. Is it your backyard? Is it your hospital? Is it your clinic? And are there places and opportunities where you can start to suggest this kind of work and find partners who will really help you champion this work? And then if you're even more interested than that, you can always team up with Abby and me and start building the movement. So next slide. And as I mentioned in a few slides ago, I think that ecosystem restoration is very important on an individual level because it shrinks the problem of climate change and of global ecosystem destruction into something that's manageable for each of us. And it really is a concrete way for you to track your own progress and feel like you're doing something good for the world. And in effect, you are, because whether or not we engage in this work will really determine whether we can save many of the species upon which humans depend. So next slide. Thank you very much for listening to our talk. And we would love to hear any questions that you have.
Carl, I think you might be muted.
Sorry, unmuting myself. Thank you again for great presentations. Abby and Allie and I are all American Academy of Pediatrics climate advocates, and that's how I met up with them in the first place at one of our monthly meetings, and thought it would be a great message for us here in New Hampshire. And I'll mention to both of you that we also have a new book club, which has decided on its next book to be braiding sweetgrass. So maybe we'll have some more thoughts along those lines after people have completed that reading. I'm curious about suggestions you have for engaging the leadership in hospitals in our state. We're about to engage in a sort of process of encouraging more sustainable policies and systems in those organizations, and I think the kind of thing you're advocating would be wonderful. One of my thoughts is that one of the hospitals in our state, Memorial Hospital in Conway, is a Maine Health hospital, and is there some reason why that might be a place to begin if they are tuned into what you, Abby, are doing in Portland?
I can just say that I have faced many more hurdles than Abby. I think Abby will be a better person to answer this question, so I'll pass it over to her.
Okay, thanks.
I mean, I think I was just fortunate to have supportive people like Odette, who I was connected to and can be a partner in spearheading these efforts, and it had a similar value system, and I would leave it at that.
I think it's really, I would say, I think it's very important to have the support of your groundskeeper. I think that's kind of where my efforts collapsed a little bit. If you can't get sort of buy-in from people on that level, then I think you're not really going to get very far. So I feel like identifying supportive partners is critical. And so I've sort of thought from my end of reaching out to other places in the city that might be more supportive. And then hopefully as we start to build more of a network, then people will start to catch on a little bit more. But certainly identifying supportive partners is absolutely critical.
Thank you. And Summer, you have your hand up, so
Yeah, so
managed to notice.
thank you. I happened to meet Deborah McGill, who's the population health administrator at Maine Medical, through a completely different venue through the American College of Healthcare Executives, which is a panel that my department hosts every year. And she was, I don't know if she knew you at the time or if she knows you now, but she was really talking about how from a healthcare executive perspective, they are starting to really think more intentionally about sustainability. And so our whole conversation got off on this climate change sustainability track, and Deborah was one of the spokespersons. And so she really did seem to be, as she said in her own words, wanting to generate change, a culture of change within Maine Medical that is aligned with sustainability principles. I don't know how many obstacles she herself faced, but I think if you haven't talked with her, she just seemed like someone who truly is trying to be a champion within the C-suite, so to speak. So she is someone I think that I hope to talk to again, because a lot of our New Hampshire hospitals maybe could think about the approach that Deborah has taken, and love to see how your work dovetails with her vision, I think.
Bob McClellan, you had a question regarding green roofs and community gardens in cities. Do you want to ask that directly?
Sure, you pretty much did, but there was another question about how you bring kids who are in kind of inner city environments into this kind of work, contact with nature, et cetera. And as we know, green spaces are kind of hard to come by in the inner city. But along with trying, one of the things that we've seen a lot of is community gardens as one attempt to do that. I don't think green roofs are so much aimed at kids, but it could be. But I'm really interested in your thoughts as to not only kind of the value to kids and adults for that matter, but also, whether there's much of an ecologic value to green roofs and community gardens, aside from all the other benefits.
I would imagine there is. I don't know about it in the context of ecosystems specifically, but I believe in the Drawdown series, there's a group called Project Drawdown in California, which looks at climate change solutions. And they do mention green roofs as a potential solution. Just speaking as someone who lived through a heat wave in Seattle last summer with no air condition, I sure hoped that there was something on my roof that could, blunt some of that heat exposure. I think that there would be benefits in that way. And then I also imagine that if we provide more food sources and places to rest for birds and bees, that I can't see how that would be a bad thing. I think that probably would be just as good. In fact, I did ask the Homegrown National Park organizers at one point, would it count if I had a little native plant garden on my balcony in my apartment? And they said yes. So I assume that would count too. In terms of kids in more lower socioeconomic settings, I think it's going to be lots of very, very localized solutions. So I know that the Green Seattle Partnership, which is our group working in Seattle, is really trying to work in areas where there are more kids who really don't have as many opportunities to get outside. I don't know how successful they've been, but I know that it's been a very big push for them to do that kind of work. And I know that last summer, with all of the extreme heat, there was a lot of discussion about the disparities in tree canopy cover between higher income neighborhoods and lower income neighborhoods. So I know in Los Angeles, they're really working on that. I can't speak to any particular program more specifically than that, but I think it would be at a very local level that those solutions would be found.
Right. I'm looking for the questions here. I'd like to invite Nancy Dana to ask your question directly.
Hi, everyone. I'm here in Seattle, Washington. Am I echoing or should I?
No, you're good.
Another place.
I think.
Okay, everything's okay. My question is related to some of the other questions, which is, how do you suggest working with highly bureaucratic hospital systems who have administrators and others who are resistant to supporting the creation of native landscape sites on their grounds? I've heard some of you say we need to form partners, but are there specific partners within a hospital organization who are key?
If anyone has the answer to that question, that would be really great.
Hi, good afternoon, everyone. Good evening, actually. I'm Odette Periel. I'm the Vice President of Patient Care Support Services at Maine Med, and I work with Abby. And Samra talked also about Deb McGill. We actually sit on the Healthy Communities Committee together. So I can kind of jump in a little bit and share from the Maine Medical, Maine Health perspective. I would say, it depends on what the structure of your organization is. As Ellie said, getting to know whoever runs the groundskeeping would be a good start. So, usually that rolls up to a division. I'm not sure how each hospital is set up, but I know in cases of Maine Medical Center, that falls under my division. So it's helpful to always have that person on board, because in terms of the long-term sustainability of a native plant project, you will need to have the buy-in of that group, because they will be the ones doing the long-term maintenance of the grounds. So that's one area. I also think most hospitals have now invested in a sustainability, whether it's a manager, a director, whatever the title is, and having that person on board as well would be a really great start. So I think in terms of just really getting to know who to connect with and to start working with, those are two departments or two leaders in your organization, I would say, that you try to connect with. Another area that would be good, especially just having listened to the presentation Abby had given to myself, is and a couple of the other team members at our organization, we've also pulled in philanthropy and our children's hospital executive team there, because the children's hospital, they're always really good to partner with. And on this platform too, we have several pediatricians on, so that that's a good ally in having the children's hospital on board with initiatives like this. So I would say if you start there, get philanthropy involved. And the other thing that we have at our hospital is our wellness committee, because another partner for Abby is Cole Firm, who is on the wellness committee, and I'm on that committee with her. So that's how we got connected. And she's a project manager at the research center who has been working with Abby on this. So, there are the overlaps of the wellness committee, sustainability. Those groups are definitely ones that I would say get their involvement in it, bring it to them and get the buy-in from them. And I think if you start there, there will be enough momentum to get things going and to build a group that is collaborative and be able to push things forward. So that's just my suggestion.
Thank you very much. That's very helpful.
Thank you, Odette.
Thanks.
I wonder, one of our sort of areas of focus in our organization is to have more conversations going on about climate and health in the interaction between physicians and patients. I'm wondering how you incorporate or could incorporate some of your ideas into actual direct patient care or into, I can imagine it happening in preventive care in pediatrics, for example. But are there thoughts you have about, or tips you have about how clinicians might be incorporating this into their care of patients?
I would say just doing well child checks for a lot of the patients that I see. There are many of them who are obese. There are many of them who spend pretty much all of their time in their apartment. And many of them don't feel safe to go outside because of the pandemic, because of perceived crime, because of being in a sort of unsafe neighborhood. And so, again, I feel quite fortunate that I'm in Seattle, which has a pretty good infrastructure for this already, but there are ecosystem restoration events that go on through the Green Seattle Partnership pretty much every day in different parts of the city. So I was thinking actually of starting to sort of refer kids to those events.
That's a good idea.
And actually during the pandemic, it was great, in some ways great, because these events were open to teenagers, and a lot of volunteer events are not open to children under the age of 16, and the kids need their community service hours. So I did actually run into a fair number of teenagers during the pandemic. But that is just one idea that I had, is to start sort of spreading the love and just actually giving people events to go to that are near their houses.
Great. Abby, any thoughts in your work as an endocrinologist? And I presume you have some patients with diabetes, for example. That
Yeah. I mean, I second what Allie's saying. I think that these sorts of like prescriptions for the outdoors are kind of like, is like a cool concept. I think for the research side of my life has a little bit, thought about this as a research idea. So someday perhaps, onboarding a resident and looking at what are the mental health benefits to patients to be involved in the weeding and the mulching. These would be pediatric inpatients who are maybe there for chronic conditions and are healthy enough to go outside and kind of, be involved. Does that improve them and their parents' experience of the hospital stay? And also thought about collaborating with, for example, a local Girl Scout troop, for one of the community education centers. So, these are just thoughts, but I think that there may be some, Summer was asking about evaluative potential. And I think that there may be, and Allie too has thought about, future research looking at mental health benefits for community partners. And I think those community partners could be kids. So it's I think two different questions. One would be from a research perspective, like garnering kids or community members and looking at what are the benefits of being involved in a project like this. And then there's also like the question of is there a way to engage our patients in the outdoors?
That's great.
I think one thing also that I really didn't think about very much before I started this work is that we are so ignorant as a society of our native plant heritage, of our natural heritage. I mean, I've lived in Seattle since I was born, and I did not know most of this stuff until 2 years ago. I could name the tree in my backyard, but that's pretty much it in terms of native plants. And so, I think that there's just so much opportunity for people to really start learning about this. And once you do, it takes on a new life of itself because you've opened this whole new world to yourself. And I find that really does sort of shift my focus away from a lot of the gloom and doom and towards something that's growing and has potential. And that's why I've done a lot of climate advocacy in my life, and I do a lot of climate advocacy in many different areas, but this is by far my favorite because it's the most positive, and full of the most potential.
Bob, you had a comment. Do you want maybe a question associated with it? Do you want to ask it directly?
Sure.
Bob Friedlander.
Yeah. So is Portland a resettlement site for refugee and immigrant youth?
Yes, it is.
Yeah, that's what I thought. And so in Concord, New Hampshire, where I live, there are lots of community gardens that are an important focus for refugee and immigrant families, especially in our city from Nepal or Central and East Africa. And I was wondering, one, if you had thought about ways to specifically reach out and engage New American youth in projects like this, and whether there would be a role for that in helping with some of the trauma-related issues that many of these children deal with, either before they came to this country or during the process of coming here or after arriving.
Abby, do you mind? I will start with answering that. So Bob, I think that that's a wonderful idea. Where we have started, we've just started with working within the hospital and looking at our children's hospital portion and seeing how we can partner with the children's hospital team to help to do tours and different guided walks with those patients who are able to do so once we get this underground. But I do agree that there is opportunity to grow outside of that. And Samra had mentioned Deb McGill, and I think I'd mentioned that we do have a healthy communities work group, which is focused on our population health. And we work across the disciplines to figure out how do we partner with the community to get involvement. And we also have our interpreter services department, which is a huge part of all the things we do on a collaborative basis with our clinics in the community and with how we partner with our patients and our team members, because you are right, we do have a large community of immigrants who are here, whether they're working. I would say at least 75% of my environmental services department is immigrants, and we have worked internally as well as externally to really build those gaps and bridges. So I do think that there is opportunity, and as we grow the program, we'll definitely look to partner with other community organizations to see how we can make that a part of our growth and get those immigrants, especially those who have had difficulties and have traumatic experiences, into therapeutic settings such as native gardens, native plant gardens. And so we'll work on that for sure.
Thank you very much.
Yes.
Yeah, thank you. Pat Edwards, do you want to raise a question?
Yeah, actually, I wanted to tell Bob one thing he might like. Our Girl Scout troop helped plant vegetable seeds for our Somali immigrants for their community gardens you were mentioning, which was a good way to get kids involved. And as for, talking with, I'm a pediatrician too in Concord, New Hampshire. As for getting parents and kids involved, we've got the perfect segue. Ticks up here. You always have to talk about ticks. You have to talk about sunscreen. So you can talk about how do they treat their lawn without using chemicals that kill critters and stuff. And how do they have shade in their lawn? My cat likes to join me. Do we have, places, shade and stuff like that? And do they have native plants? We start talking about our gardens and stuff, and that's just brings it up naturally, I think. So when you're asking about all those things that climate change affects and then pointing out that climate change is affecting that, we can help it in our backyard.
Thanks,
That's all.
Pat. I think, Samara, you have your hand up too.
For if you're ever looking to think about, when you get to the point of wanting to think about evaluation and research, there's a qualitative approach called photo voice, which can be very nicely incorporated either alongside quantitative information, but it really allows the lived experience of people coming from very different perspectives, such as refugee and immigrants. I've used it a lot with refugee families, and it allows them to use photography as a way to document their lived experience of different environments. So it can be a really positive and life-affirming technique to use.
Thanks, Summer. We're reaching the end of our time, but I want to comment that we, the New Hampshire Healthcare Workers for Climate Action, are running a ECHO course, this 12-week, 6-session course on climate and health. We're about a third of the way into it. And we begin each session with a land affirmation from local Indigenous people. And it's been quite, I think, effective. And Bob, do you want to ask your question directly? And seems to relate to that a little bit.
Sure. Not so much a question as a comment. I think it was Ali who said, I don't know much about, the fauna, the flora where I live. There were people before us who lived here who knew quite a bit about how to live sustainably. And as Carl just mentioned, it's so powerful to have some local Indigenous peoples leaders begin our climate and health session. And I think, as has been in the news, there's oftentimes the Indigenous peoples trying to protect their ecosystem from extraction industries or whatever. It's clearly the opportunity to collaborate and learn more about what they know about how to maintain our ecosystems.
Thanks, Bob. Any other comments or questions from anyone?
I would just go back. I think someone asked about the book that I had recommended, other than Nature's Best Hope. The other one that I discussed was called Braiding Sweetgrass by Robin Kimmerer, so Kimmerer. And she's actually part of, I can't remember which native tribe, but a tribe in New York. And she was also trained as an ecologist. And so she is sort of blending together the science and the Western philosophy around ecology, and then also this more traditional, sort of more relational feeling that one has. And it's just a beautiful book if you're looking for more recommendations.
Well, and anyone who's on this call, because it's not a huge number, would invite to join our next book club meeting in Emily. It's in July, but July.
Second Wednesday of July at 7:30 p.m.
Second Wednesday at 7:30. The book will be Braiding Sweetgrass. And we enjoy getting a group together who want to discuss that experience of reading. And with that, I think we've arrived at 7 o'clock. I really want to sincerely thank Ali and Abby. They're very busy, unlike at least retired pediatricians like myself. And this has been an excellent presentation and really in line with all of our interests here in New Hampshire. So thank you. And I'm seeing clapped hands around, but we hope we can continue to collaborate with both of you in all sorts of ways. So thank you all for attending, and we'll see you next time.